Welcome to today's session entitled Social Isolation, Impacts and Age-Friendly Interventions. Before we get started, I would like to go over a few items so you know how to participate in today's events. When you join today's webinar, you selected to join either by phone call or computer audio. And if for any reason you would like to change your selection, you can do so by accessing your audio pane in the control panel. You will have the opportunity to submit text questions to today's presenters by typing your questions into the questions pane of the control panel. And you may send in your questions at any time. We'll collect these and address them during the Q&A session at the end of the presentation. I would now like to introduce John Feather, CEO of Grantmakers In Aging and moderator for today's webinar. Welcome, John.
Thank you so much, Karina. I'm delighted that so many of you have joined us today. GIA is continuing this series of webinars designed specifically to encourage greater philanthropic engagement in age-friendly community efforts throughout the country. We thank the John A. Hartford Foundation for their continued support of this series, making it available to our audience free of charge. And a special thanks to Jean Anthony for her help in organizing today's session. The objective of this series is to bring attention to topics and issues that relate to age-friendly community efforts and the challenges they face. And today we're talking about a particularly difficult challenge in this arena. Loneliness and isolation among older adults has been demonstrated to adversely impact both mental and physical well-being. Recent studies have outlined that social isolation among older adults is associated with both increased healthcare spending by Medicare and also other difficult and damaging impacts. Some suggest that social isolation should be considered a social determinant of health. Joining us to describe their work for their organizations designed to reduce the incidence of social isolation and describe interventions being undertaken are two national experts. First, Dr. Elise Hernandez, who joined Meals on Wheels America last year as the Research and Analytics Manager, where she currently leads the portfolio of research and initiatives to expand and enhance socialization efforts among Meals on Wheels programs throughout the country. In her role, she also helps build the evidence base to demonstrate the impact of senior nutrition services more broadly. Dr. Rodney Harrell is Director of Livability Thought Leadership at AARP. In that position, he leads AARP's Public Policy Institute's Livable Communities work. His research on housing preferences, neighborhood choice, and community livability are integral to the world-renowned Livability Index that measures the livability of every U.S. neighborhood, which he and his team created. He also serves as AARP's housing expert and leads the Future of Housing initiative. So we welcome you both. As was mentioned, we will have an extensive period for questions and answers at the end of the presentations. So please open the question box at any time and type in your questions, and I will be asking those to our distinguished panel at the end of our time. So Rodney, let's begin with you. Give us an overview of the issues of the impact of social isolation.
Sure, I'll be happy to, and thanks for having me, and thanks to Jean for organizing, and thanks to all of you for participating today. Want to talk about and open up our conversation by talking about social isolation, livability, and age-friendly communities, and give an overview of a couple of things. One, I want to talk about some new data that's just been out from the Census Bureau. Two, I'd like to help describe social isolation and some new research from the AARP Public Policy Institute, and then talk about and begin the conversation about strategies and tools that can help to address social isolation. And I'm trying to do all of that within about 15 minutes, so please, I'm going to move quickly, and if you do have questions or any thoughts about details, there's a lot that I had to cut out of this to get ready for our conversation today, so please send those questions in. So if we go to the next slide here, it's a little bit about what AARP is, for those of you that may not be 100% familiar with our work in this space. AARP's large membership organization that looks out for people age 50 plus and their families. And I'm part of two groups simultaneously. Our Public Policy Institute that does research, policy analysis, and helps set the policy direction for AARP and do innovative work in that space. And also our Livable Communities group, which is a group that spans AARP across different issue areas to work on creating livable communities for all. And the idea and the most important thing for AARP is that livable communities are communities that work for all people of all ages, regardless of their age, their income, their physical ability. And the most important part that's relevant to our conversation today is about giving options. Our policy goal really surround providing options for all people that need them and the right kind of options to meet their needs. So I'll talk more about that a little bit later. Next, I'll talk about some new data on the next slide from the US Census Bureau that just got released last week, actually. So I've been using for the last decade or so our last population estimates, but hot off the presses are these new estimates that show that now by 2030, over 70 million, and now 73 million of the population will be 65 and older, and over 20% of the population will be 65 plus by 2030. On the next slide, we can see that the graphic that the Census Bureau prepared that shows that we're aging at a increasing rate as a country, and that older adults are basically going to be the same as in terms of population numbers, roughly between 2030 and 35. But after that point, older adults will outnumber children. That's what this chart is showing us. So in other words, what we're saying is older adults didn't used to have to be part of community conversations. They were a relatively small part of the population, and although they should not have been ignored, many community leaders did so. But as the years pass, and certainly by 2035, according to this, we're going to have people of all age groups in almost every community. So we need to pay attention to the needs of all people of all ages in our work. So that new data, I think, is going to help us to understand some of those key issues, including the issue of social isolation. So as we go to the next slide here, we can look at the prevalence of social isolation. And really, when I think about social isolation, I think about it as part of a three-member gang of problems that impact people. Social isolation, physical isolation, and loneliness all go together. That people that are socially isolated don't have social networks to connect with folks. This stat here that 1 in 4 people live alone, that puts them at risk of being physically isolated. They may be in communities or maybe in homes that are in neighborhoods that are not really connected to people. I think of many older adults in communities in the Midwest, for example, where I've talked to some folks that were the only home left on the block was this person, and she or he had been there for 40 plus years, and everyone else had moved out. So physical isolation is a big deal. 1 in 5 older adults feels lonely. That's a big problem as well. And that average network size of 4 persons. So you can imagine how important social networks are for people and how much they can fall apart. And if they do fall apart, how that could have impacts. So let's talk a little bit about the risk factors for social isolation on this next slide here. And this was gathered from a few different sources from our friends at AARP Foundation. And when Elise and I looked at it, we came up with these lists of risk factors that we wanted to talk about for today. So living alone, folks that are unmarried or are widows or widowers, family caregivers. As we age, there's more of a chance that our families have passed on. So that's definitely a factor as well. Low income and low resource persons, So when you're in communities like that one I described that may be disinvested, jobs have gone elsewhere, neighbors have gone elsewhere, you may find yourself at risk. Having a physical impairment is big, and functional limitations I'll tie together, that if you do not have the ability to navigate your home or community, you don't have the ability to take care of yourself, these can lead to being isolated and exacerbate the problems of being isolated. Next on that risk factor is rural, unsafe, and inaccessible residences. And this, we talk often about people in rural communities potentially being isolated, that no matter what kind of community we love and grow up in, if it's isolated from folks, there may become a point where we can't connect when we need folks. And I expanded from this. We had first just had rural, but I expanded it to unsafe and inaccessible communities as well, because it also can be an issue in urban and suburban places. We may have bought some home on a quiet cul-de-sac that seemed like a great place at the time, but if our spouse passes, if some of our neighbors or friends' social network moves away, and if we don't have access to transportation to get around to visit people or communication to talk to people, we could be very isolated. So that's definitely a risk for social isolation as well. And quickly looking at the consequences on the other side of that slide, if we can go back for one sec to that slide we just had, mortality, mental health, cognitive decline, losing our independence, chronic illness are big ones. So there's lots of consequences to this, and the research has shown. And a recent study on the next slide talks about the healthcare costs. So if we can move now forward, we'll see a new study that linked data from the health and retirement study to understand who was potentially socially isolated with Medicare claims that showed the actual spending that Medicare spent on those persons. So it looked over 5 years to do this. And this is a study, you can see the study on the next slide. It is from our friends here at the Public Policy Institute, Stanford, and one colleague who's now at Harvard. And the title gives it away. If you're wondering if it's an issue, the title tells us that Medicare spends more on socially isolated older adults. And the sum of that is, on our next slide, that Medicare spends $6.7 billion every year because of social isolation. And so when we think about this, this is an issue not just for the person who's impacted, for their family members that may deal with it, but also for society as a whole. And in that study, on the next slide, they looked at a little bit about who is isolated. And they found that within their study, men, people who are depressed, the dual eligibles, those who qualify for Medicare, Medicaid, and again, those who have functional limitations, those are people who are more likely to be isolated. So all groups we need to worry about, and all groups that are not only at risk personally, but also from a government and taxpayer standpoint. So we need to pay attention to that as well. Okay, I feel like I've been pretty depressing so far. I've talked about some of the problems and the prevalence of this, but let's talk about some strategies and tools. So let's go to that next slide there. And the first one is on the next slide, which is the network of age-friendly communities. And for those of you who aren't familiar, AARP is the U.S. affiliate of the network of age-friendly communities. It's an international program, first begun by our friends at the World Health Organization. And the idea is that communities can take steps to work, again, for people of all ages, to make sure they work for people of all ages. And now this network, on the slide, it shows 208 communities. As of today, we're up to 226 communities and 2 states, New York and Massachusetts, that have joined this network and are taking steps to attack some of these issues. So on our next slide, I want to quickly talk about the age-friendly domains that these cities are tackling. So there's 8 domains, starting clockwise from the top there: transportation, housing, social participation, respect and social inclusion, civic participation and employment, communication and information, community support and health services, and outdoor spaces and buildings. And the idea of this graphic is to show that all of those 8 things are interconnected. One of the biggest problems I have with the way that many of us look at these problems, or generally facing individuals and communities, is that we look at things separately. If I'm a person who is in that isolated neighborhood I talked about earlier, well, I need transportation, perhaps, so that my friends or family could visit me or I could visit them. Housing costs, maybe the reason I'm staying there is because I can't afford my housing, or maybe I'm isolated because my housing doesn't work for me. Being respected and included is part of isolation as well, that if I don't feel like I'm a member of my community or that my contributions matter, that is a factor. So the idea is that these things are interconnected. And if we're going to solve problems, including social isolation, we need to take a holistic approach. And that's what the age-friendly process does. These communities talk to individuals in the community. They develop plans and then execute them over a 5-year period to ensure that they have these needs met. And I'm a big fan of that approach for communities. The next tool I want to talk about is our livability index on the next slide here. And there is the link above. I don't have a lot of time to get into detail, but you might want to check this out during the question and answer period. But we developed a few years ago the world's first nationwide neighborhood-based livability index. And this is a tool that for every neighborhood in the country, and if you go there, you can type in your address and it'll give you a score for your neighborhood. And on the next slide, we'll see that similarly to the age-friendly program, we look at several different areas. So let's go ahead to that next slide and look at these areas in the index. So the index has 7 areas, as opposed to the 8 of age-friendly. And the idea of the index is that we wanted to have the elements that we could measure nationwide. So we had to come up with scores for every neighborhood, which meant that we needed things that we could measure. And some of those things within the age-friendly framework are difficult to measure nationally. So our index represents all those things that we can measure. There are 7 categories here. I'll go again clockwise from the top. And our most relevant one for this conversation is probably an engagement group, which I'll talk about more in a second. We also look at economic and other kinds of opportunity. We look at housing, housing accessibility, and a range of housing options as well. We look at neighborhood factors, which I don't have time to go too much into today, but I'll say that having neighborhoods that you can walk around, that you can get to places you need, that's a big way that communities can physically meet the needs of people and help folks to be less isolated. And also transportation, which I don't have time to talk a great deal about, but having options to get around. We did a study about a decade ago now on housing locations near transit, and it was fascinating to me to go out to cities around the country and see older adults in these places that were well served by transit options. Those folks seem to have more visitors and more connections with their families than those that live further away. So we have to remember it's not just the options for the person that we're thinking about, but also their network, their friends and family. The livability index also looks at environment and health factors, and those are important as well as looking at when we look at livability as a whole. So if we go to the next slide, I'll just show you quickly how this thing works. So if we clicked on AARP's address, I've typed in there the AARP national office in DC, you can see at the top there. And I've clicked on social engagement for this neighborhood. And you'll see here that we look at a range of factors here that are ways that people can be connected. Internet access, so that we can connect through all of these new technologies that are coming. This is our way of capturing our ability to do that, that having low cost, high speed, available internet access is key to do that, and to do things like participate in this very webinar. Civic engagement, we look at the ability that people have to be involved in their work socially in their communities, whether it's volunteer opportunities or other work that you may want to do in your community. It helps to be able to be engaged there. And you can see that that green light means that this neighborhood has a high amount of those. We also look at how people actually are engaged, looking at voting rates. There, the next, you see social engagement through the social involvement index. And what I've done here is I've actually clicked on this one to give myself more information. And you can do this with any of these measures in the index. And you can see this is a place where Washington, D.C., the region struggles a little bit. It's a red flag because people aren't as engaged with one another. Their social connections to people through the extent to which they interact with their household members, see or hear from friends and family, talk to neighbors, etc., in this neighborhood is lower than the national average. And finally, cultural arts and entertainment institutions are things we look at in this measure. So there's 40 things in the index and 40 metrics and 20 policies, and this is just a flavor of them. But I wanted to highlight the social engagement ones to show how important we think having different types of engagement are to keeping people involved and preventing and addressing social isolation. But as I mentioned, there are several issues in other categories. So if we look at our next slide, we'll see one of the important things we have is the ability to personalize your score on the index. So underneath that, or at the bottom left, there's a place that says customize your score. And when you do that, you can actually change these sliders up and down to change the weights of individual categories on the index. And I point this out for a couple of reasons. One of which is because some people will say to us, well, look, I prefer rural areas. I'm still healthy. I'm still active. My friends are here, or my memories are here. And so that person might take our neighborhood category and slide it down for them personally because it's less important. But on the flip side, if you're someone who's thinking ahead about what you might need later and how much of an issue that may be, you can push that slider to the right and think about how much those options may impact your ability to stay in a community. And as you do that, that would change the score, as you can see up the top, for any particular community. So if you have any questions about things in the index and the like, we can talk about those later. But before we transition, I want to talk about one kind of unique example that I haven't talked about much, and we'll talk to you about it today on the next slide. And that's our future of housing work at AARP. And we did a big project with the national design competition, and it was around building a home for the future. The main focus was the idea that we would build a home that had that addressed our aging population by having some of the accessibility features that we might need as we grow. But we asked our architects, and this competition was amongst the architects from around the country, to address a range of issues, including social isolation. So what I want to talk about here is how design can impact social isolation. So let's look at so that's the house, by the way, on the left, and on the right-hand side, you can see the gentleman and his mother there that received the home. But let's look at the actual designs behind this house on the next slide. And so this was the original design of the architects of the house here. And you can see some innovative things here. You can see that there's gardens on the outside, and the winning architects, with their design of these gardens, made a point that people in the community could help interact with you as you're working on these gardens and this garden space, which I thought was a really innovative thing. And right behind there on the right-hand side of the building, you can see a giant glass wall was their original intent. And let's look a little bit more about that on the next slide. And as you look into the house here, you can see even that front, there's a front right of the house, and then that other side of the corner. The original vision was huge glass windows, and there are two purposes for those. One was to provide a great deal of natural light. We need more light as we age. But the other idea was that someone in the home would interact more with the neighborhood, that you'd feel less socially isolated and shut in by having walls all around you than if you had this amount of glass facing us. Unfortunately, the inspectors and the code board of Shelby County, Tennessee did not necessarily agree 100% with that vision. So the final vision didn't have as much of this, but we certainly opened up and added a lot more light and glass to that part of the house so that those folks there can interact. And let's go to this next one here and look at this other part of the house. This shows two things in the house. One, on the right hand, you see the circle for the kitchen area that we just looked at. But on the left hand is a bedroom in the house. And what I really liked about this is that on those corners there are what are movable walls now. So if you can picture this, those walls on the top and side of that building, they're highlighted in bright white in that left-hand circle. Those can be moved and moved away. So what that does is this person, if this gentleman's mother becomes unable to get out of bed at certain times, they can open up that bedroom, and so she can take place in the activities of the living room. So even within the home, she can become less socially isolated if her son and family are in the house. And of course, the walls can be closed, as you see here, for privacy. So this is just a great example of how you can start to use design and think in different ways about preventing or addressing social isolation. And these same kind of principles apply not only within your home, but in the way that we design communities as a whole. That when we think about addressing these needs, we can do so in a way that doesn't make something limited or cause people to be isolated. We can actually address it while we're addressing other needs. And if you want to talk about more examples in the question and answer, we can do that later. The last resource I want to talk about is on my final slide, and that is the work that my friends are doing at AARP Foundation. So if we can go to that final slide or that next slide, we can do that. And my friends at AARP Foundation and the other groups there you can see on the right have started Connect to Effect, yet another website that you can go visit. And they're actually working to try to end social isolation. And so on that website are a lot of resources for individuals and others on social isolation and how to address it. I can't recommend it highly enough. I ask that you go in and look at that in your free time. So what I've done in my time here is really talk about how social isolation is an issue. It's an issue not just for individuals, but for their families and society. And then I've talked about some of the approaches that we can use to help tackle it. And we need to look holistically and look at some solutions that address multiple sides of the issue, of the issues facing older adults, excuse me. And so I'm excited to hear what Elise is going to talk about in a second. So with that, I'll turn it over to John.
Well, thanks so much, Rodney, and very important background information and lots of resources. So thank you for that. Just a reminder before we move on that we will have a question and answer period a little bit later. And please go ahead and open the question box that you see on your screen and type in your questions, and I'll be asking those in just a few minutes. So Elise, let's turn to you now and talk about some of the work that Meals on Wheels and its national organization are working on.
Thank you, John, and good afternoon, everyone. I'm super excited to be joining you in this discussion, and I can't thank Rodney enough for setting up the sort of big picture so that I can transition into what Meals on Wheels does and our approach when it comes to social engagement. Next slide, please. So to talk a little bit about Meals on Wheels America, we're the oldest and largest national organization representing community-based nutrition and meal services across the country. And we really work to empower local community programs to improve the health and quality of life of the seniors they serve. so that no one is left hungry or isolated. And we do so through advocacy, education and training, galvanizing partnerships, and research. And on the next slide here, you can see that the senior nutrition programs really represent more than 5,000 independently run local programs that exist in virtually every community in America. And they include both congregate and home delivered meal programs. They reach more than 2.4 million seniors each year, 850,000 of which are folks who receive home delivered meals. More than 220 million meals are served annually, with roughly 1 million meals being served each day. So all of that to say that this network is very far-reaching in their impact. So on the next slide, when we think about age-friendly communities, most social engagement efforts and interventions are really trying to get folks out of the home, which is really important. But there are an estimated 2 million older adults in the U.S. who are homebound, who really don't have access to get out of the house and don't have the same opportunities to engage in activities. So they remain a hidden and unserved population unless someone comes to the door. So on the next slide, this is really what makes Meals on Wheels services actually getting to the door really important. It facilitates frequent social interactions and social engagement among a client profile that has many risk factors for social isolation and loneliness, many of which Rodney alluded to earlier. That is, 59% of home delivered meal clients live alone, 76% are unmarried or unpartnered, nearly half are part of the oldest age group, 85 years or older, 79% face poverty, 1 in 4 are rural residents, and 1 in 3 have fallen in the past 3 months. So this is definitely a demographic that needs attention. Next slide. Age-friendly communities, as Rodney talked about earlier, are those that really facilitate frequent interaction amongst neighbors and friends. And Meals on Wheels really helps with these social engagement because they open the door, essentially. And they open the door to about 40% of clients who would have little daily contact if it were not for those Meals on Wheels volunteers coming to the door. And volunteers are often actually older adults themselves, and they report many benefits from volunteering. So it's important to keep that in mind as well. And the daily and weekly contact that volunteers have with clients really builds trust that then allows them to deliver on the rest of what Meals on Wheels services have to offer. Next slide. Which is why we often talk about providing so much more than just a meal. Research done on social determinants of health really suggests that there's a lot more than just genes and biology and medicine at play when we look at health outcomes. It's the environment where people live, their social context, and their access to opportunity and basic necessities that are really also driving health outcomes. And so the ways in which the social determinants influence one another also suggest that the solutions that we're sort of putting out there need to be addressing clients' holistic needs. Again, Rodney talked about this earlier. And for us, it's the integration of nutrition, socialization, safety, and community connections that lead to positive health outcomes. And with social isolation, we know that it puts seniors at risk for malnutrition, for example. We also know that safety hazards lead to injury from falls, which make it difficult for folks to get out of the house, leading to further isolation. And the stress and sadness from feeling isolated keeps people isolated, essentially, if nothing is done about it. So providing a warm meal delivered by a friendly volunteer who consistently shows up expressing interest and care and concern, who can also check for these safety hazards and assess for other needs and make referrals in the community, provides a person-centered approach that really does lead to some positive outcomes. And we like to think of each of the areas in our service offering really touching and depending on one another. It's a very integrated intervention. Next slide. And this integration of services really gets results. So clients say Meals on Wheels services improves their health, makes them feel safe, and allows them to remain at home. And research has also demonstrated that decreases in rates of malnutrition and food insecurity. It prevents falls, it reduces feelings of anxiety, and of course, it reduces feelings of loneliness. So next slide. So as we're learning more from research, addressing social isolation really is more than just a feel-good issue. Social isolation has very serious consequences for mental and physical health. And so I think that the first and most basic intervention that a lot of Meals on Wheels programs do is actually screening and assessing for social isolation and loneliness, really working hard to make the invisible visible. And screening and measuring for isolation and loneliness also helps these programs determine whether clients are more objectively disconnected, that is, having small social networks or physically isolated, as Rodney referred to earlier, versus those clients that are more dissatisfied with the level of social interactions that they have with others. And assessing for this different really guides programs in the type and the level of socialization efforts that they put forth for clients, reiterating the sort of person-centered approach. Next slide. So in this, there really is a spectrum of opportunities for social engagements offered by Meals on Wheels services. As we like to say, once you've seen one Meals on Wheels program, you've seen one Meals on Wheels program. And social engagement here is the same. It can range from low effort to really highly intensive. But one service that's pretty consistent is that volunteers are visiting their clients, having face-to-face contact during the meal delivery, briefly checking in with them. And some programs will actually shorten certain routes in order for volunteers to spend a little bit more time with clients who are especially lonely, because food safety regulations sort of dictate that they can't leave the food in the car for too long. So some programs work around this by having different routes for socially isolated clients. And many programs will refer clients to other social engagement resources in the community if they can't provide those services themselves. Next slide. So many programs also have telephone reassurance, where volunteers can check in on clients who miss meals or follow up on any concerns that the volunteer driver noted during their visit. Some telephone reassurance programs offered by Meals on Wheels are hotlines, actually, where seniors can call anytime during the day to talk, to express any concerns that they have. Or there are also programs where volunteers actually make regularly scheduled weekly calls to engage clients in casual, genuine conversation just to see how things are going and to let them know that someone cares. Next slide. There are also other types of supports like holiday and gift drives, where programs often work with local schools, churches, to make sure that seniors feel included and remembered during what can be especially lonely times throughout the year. Other programs arrange for transportation so that seniors can go to lunch outings, to local restaurants, or attend special events at their local senior center. Many Meals on Wheels programs also include pet assistance programs that provide food and vet and grooming services to seniors who have pets, which is particularly important because we know that pet ownership is associated with lower levels of loneliness and better health, and that pets can sometimes be seniors' primary companions. Next slide. So finally, many Meals on Wheels programs do what I refer to as friendly visiting plus, where volunteers visit client homes outside of meal delivery and engage in any number of different activities, and I'll go through some examples here. Some volunteers spend time by providing practical help, like help with grocery shopping, household chores, making calls. Others have volunteers visit clients weekly to have conversation over a shared meal. Other programs are helping clients get trained on the use of technology for social media and other ways to engage via the web and virtually. There are also programs who have arts projects where they have visual artists or dancers coming to clients' homes to engage in that type of activity with them. And each of these approaches really provides a foundation for socialization that can be expanded and innovated to provide even more enriching engagement for seniors. And really, all approaches are about building mutually beneficial relationships with seniors, where the seniors feel like they're contributing something as well, and that establish rapport and maintain relationships really beyond the formal service itself, so that seniors have a network that they can go to when they have needs and concerns. Next slide. So each of these approaches is really only as effective to the extent that they're person-centered and culturally tailored, which means that Meals on Wheels programs and other community-based services engage in outreach to enroll seniors from minority backgrounds. They conduct community needs assessments to hear from seniors themselves on what they would like to see in these projects and initiatives. They work hard to reduce language barriers by having bilingual volunteers and making materials available in many languages. They work hard to match clients by their interests and by shared backgrounds. And they really develop structured activities and conversations that address culturally relevant and personally relevant topics to the seniors that they're working with. Next slide. So there are many, many good approaches out there, but the one thing is that research has been inconclusive about which interventions are most effective and which are feasibly implemented across many types of community-based service organizations. And with that in mind, Meals on Wheels America is partnering with university researchers to design a social isolation intervention project that will test and compare two promising socialization efforts, those being the sharing a meal with seniors over lunch and connecting seniors virtually to one another and to congregate meal sites via video conferencing so that they can share a meal that way. It's rolling out in 3 phases, the first of which is a pilot to train these folks to use technology for video conferencing to make sure that that training works. The second phase is a larger scale intervention which will actually compare the effectiveness of the shared lunch and then the video conferencing interventions. And then the third phase, we're really looking to summarize our learnings to inform which interventions should be scaled and implemented across the network. Next slide. So we can't really reach those who are invisible, and so moving forward, meeting and finding socially isolated clients where they're at, and especially those that are at risk, is really crucial. So we're looking to support our programs, our Meals on Wheels programs, in expanding the use of screening tools and in working with our healthcare partners to do the same within healthcare and other community-based settings. We would also like to scale the least intensive efforts so that more people are reached, like telephone reassurance, for example, and basic friendly visiting, because we know that some contact is definitely better than no contact. And in fact, we have a toolkit in the works that will provide a step-by-step guide on starting a friendly visitor program. And it's also important that we take a step back and think again about the big picture solutions. For as much as social isolation and health consequences is making headlines, there needs to be more work on policies and national campaigns that focus on this issue, especially when it comes to homebound individuals. AARP's Connect to Effect, as Rodney mentioned earlier, is a great example, as is the UK's campaign to end loneliness. And we also need to focus on prevention as much as we focus on intervention, which really includes providing supports to those folks who are doing caregiving. Next slide. So the good news is that everyone can do something right now today to address social isolation and to continue making communities age-friendly in this way. Reach out to your local Meals on Wheels programs to find out more about the work that they're doing. Help facilitate community partnerships to create and support initiatives. And definitely check in with us for updates and results from the intervention research that we are conducting and the other initiatives that we have underway here at Meals on Wheels America. Next slide. You can visit our website to learn more about the work that we do. That is www.mealsonwheelsamerica.org. And finally, next slide. If you want to keep the conversation going after the webinar, I am very, very happy to do so. I'm incredibly passionate about this work and really love to hear about the innovative ideas folks have about how we get isolated clients engaged. And with that, I want to thank you so much for your time and attention. I'm going to hand it back over to John.
Well, thank you so much, Elise. That was, it's wonderful to hear about the great work that Meals on Wheels is doing across the country and the research that it's engaged in as well. We have some time for questions. You still have time to put those in if you would like. But let's start off by asking a broad question, and I'll start with you, Rodney. How are you defining social isolation, and how is it different from loneliness in the way that you define it?
Sure, that's a great question, John. So social isolation to me is, the actual lack of contacts and ability to interact with other folks with your social networks and the like. And so the loneliness is a personal feeling that can be a problematic issue for a person. So they clearly go together. And if you're feeling loneliness and you are socially isolated, that's definitely a 1-2 punch. But to me, in other words, social isolation is more objective. We can look at that from the outside, but loneliness is something that you can only know from talking to a person.
Okay. Elise, you talked about the screening tool and the work you're doing on research in terms of the work that Meals on Wheels does. But this is a question about, is there a similar screening tool for social isolation that can be used in a healthcare setting, a hospital or assisted living or those kind of places?
Yeah, of course. One of the most commonly used tools is the UCLA loneliness measure, and there's actually a version that's really only 3 questions, so it's pretty quick to implement, and it's been tested to make sure that it's valid in terms of catching loneliness. But that's been used in several different healthcare settings, and in fact, we're using it in one of the studies that we have going on here. So I would suggest the UCLA loneliness scale, the 3-item version for that.
Okay. Rodney, back to you. A question about the livability index and how often it is updated, and if a community wants specifically to update the information that's there, how do they go about doing that?
Thanks for that question. And so the livability index was launched in 2015, and we did a policy update. So I mentioned those 40 metrics that are in the index. There's also 20 policies that communities can take to help start to address those issues, and we measure those as well. We did a policy update in 2017, but coming this June, or this summer, I should say, to give myself a little more leeway, but coming soon this summer is a full update to livability index for the first time. So this is a kind of a point in time thing that it doesn't update. It's impossible to get all these data sources to update on a regular basis. But what we're able to do this June is we're going to have this first measure over time in the index. So you can look at your 2015, 2017, 2018 scores side by side and get some clues to how your community is either improving or worsening on each of those things. So look for that early this summer.
Okay. Question for either one of you. Is there either funding or example programs that you know of that support pairing a volunteer companion with an isolated older person, particularly at no cost to that older person? You talked about telephone reassurance. Are there other programs that are coming online?
So since I've got the microphone already, I think one thing that we probably should mention is the shared housing work that's being done. And I know there's a national shared housing resource center that you can find online. But I love the places that are taking initiative on helping people that are trying to enter shared housing situations. And some of those age-friendly communities are doing that as part of their strategies. And basically, that's taking your home. We've got many people who are living in their home alone. And we have folks who are in need of housing. So folks can be matched up there. And whether you're doing this for income, for companionship, and in some cases, light caregiving tasks as well, can be done. And even my own grandmother used that before she passed, had a college student that moved into her home, and it did wonders to prevent her from being socially isolated and lonely. So big fan of those programs where they are. There may be one in your community. I would check that National Shared Housing Resource Center to find out.
Elise, anything to add to that one?
Yeah, I would just say that it does really vary from community to community in terms of what's provided and what's provided at no cost compared to some costs. But the elder care locator, which is provided through ACL's website, eldercare.acl.gov, is a really helpful resource for folks looking for some kind of program that might be a senior companion or friendly visitor type program to see, what's going on in their own community.
Thanks very much. This is a question about one of the things that you raised as a risk factor, which is residents in a rural area. And this is a question from someone in Montana that's talking about being in a part of the state where there are fewer than 4 people per square mile, frontier areas that are defined. And are there programs that seem to work in that area? Once again, the telephone assurance was one that they referenced. Do you know of other programs or efforts that are underway in these probably more than rural areas that really are very difficult to serve in the traditional ways? Elise, do you have something on that? Or go ahead, Rodney.
Well, yeah, I'll just jump in since with some thoughts here, because I think it's there's certainly a challenge for our rural areas, and I think there's a couple of thoughts here. One is that on the transportation side, that's one of the key issues, I think, and so there's been some headway in terms of inner city transportation issues, and I know Washington State has done a lot in their rural areas that have been very successful. And sometimes volunteer driving programs can be helpful to folks in rural areas who can't get around the way they used to. But for me, the biggest thing is knowing the issues that are there while you still have a chance to address them. So I remember talking to a woman who was 85 or so in outside of Alabama, and in a focus group we did, who lived in this house in a rural community, a large house, and she wasn't thinking ahead, and it really it shocked me at the time, and it no longer does. That she felt she was fine. She said, "I'll worry about that when I get old," which I found surprising to hear from an 85-year-old. But I think hopefully what we can have is a wake-up call for those that are in these areas, that you don't want to have to find yourself in a circumstance after a spouse has passed, or you're no longer able to drive and find yourself isolated. It's good to think about options and opportunities before then. So I know awareness is one big thing that I'm a big fan of, building that awareness.
Elise?
Yeah, sure. What I would add is not so much as a solution, but one of the issues that we really need to think about addressing to make interventions more accessible in rural communities, to really expand broadband access. Technology can really be a powerful tool for folks who are physically isolated, as Rodney puts it, but they can't have access to those tools unless they have broadband internet access. And so I think that one of the things that we really need to be focused on is making sure that that broadband internet access is expanded to a lot of these areas.
Yeah, and Elise, let me second that and say that a lot of the new solutions that are coming out, really most of the technological ones, can, to your point, they can work in rural areas the same way that they work in an urban or suburban area. And the fact that this new technology is web-based can help to start to erase some of those barriers we used to feel. It may be harder to deliver something or to travel to someone who's in a rural area, but if it's a matter of doing things with online capacity. There's no difference. So I think that's a great point.
At this point, we have a number of questions, but we're going to need to move on to close our session. But I would like to ask each of you to give your final comments to the audience. So, Rodney, let's start with you.
Well, sure. I'm sorry that we didn't have enough time for questions. I think I'm big on Twitter, so if you didn't get my Twitter address earlier, at Dr. Urban Policy, that's at Dr. Urban Policy is my Twitter handle. And I just want to wrap up by saying that we talked about a lot today, and even that last point I just made about technology ties to what my main point of the day is, which is that the way forward here is to think about integrated solutions. We shouldn't just try to address one issue at a time or one problem at a time. It's by tackling social isolation and loneliness and improving social connectedness, in addition to some of the other things we're working on, whether it's technology or housing or transportation or food and hunger issues. The best kind of solutions are those that can attack these problems at once. And we've talked about a lot of good ones today and hope they help some folks.
Elise?
Thank you, John, for this opportunity to close out. I think that for me, when I think about addressing social isolation, I think of a couple things. The first thing is that really thinking about intergenerational approaches is important, because we know that social isolation is not just an older person's issue, but a population-wide issue. And so if we're thinking about, again, not just intervention, but prevention, that's particularly important. And a lot of our programs do partner with high schools, for example, to recruit their volunteers and to have that intergenerational contact. And the second thing that I'll say is that it's really, really important that we continue to do research, that we're screening and that we're measuring the changes that we see in isolation and loneliness, so that we can speak to the effectiveness of these interventions and why they should be funded and why people should be doing them, because we need to show that impact in order to keep them going. So that's where I'll end.
Well, thanks. I do want to thank Dr. Elise Hernandez, who is the Research and Analytics Manager at Meals on Wheels America, and Dr. Rodney Harrell, who is Director of Livability Thought Leadership at AARP. We thank you for all that you do to make life better for older adults and people of all ages. We also want to thank the Johnny Hartford Foundation for their support of our Age Friendly Communities series. We will be making this presentation available to anyone who wishes to view it later, including both the slides and the audio. Please watch for a rebroadcast link on our website, or contact us at Grantmakers In Aging at info@giaging.org. And please join us for our next webinar, which is When Hospitals Deliver More Than Healthcare, on April 19th at 2 p.m. Eastern Time, featuring Randy Ustra, the CEO of ProMedica in Toledo, Ohio. This will be part of our webinar series on providing better care for people with complex health and social needs. You can register for this webinar at our website, giaging.org. And finally, I want to thank all of you for participating in today's webinar. Have a great day.